Good afternoon. I am Dr. Archit Chitnavis, Fellow of Diabetic Foot Surgery at SS Daheja Hospital, Mumbai. We have here with us Dr. Arun Bal, who is the head of podiatry department of the hospital, and he is the chief diabetic foot surgeon of India all over, the founder president of Diabetic Foot Society of India. We are very pleased to have you here, Bal sir. Uh,
Okay. Now, good afternoon, Archit. See, the today's topic is why do the diabetic patient get foot ulcers?
Correct, sir.
See, if you see the ICMR statistics, which were published in 2023, it
Hmm.
shows that there are 100 million diabetic patients in India. So you have
Correct.
200 million feet to look after. So that's a huge task. As of today, the amputation which are done below knee or above knee for diabetes patients are almost 200,000. But the tragedy is that 85% of these are completely preventable because they are due to the neuropathic ulcers. So it is
Correct.
very important to realize why do the neuropathic ulcers occur, and incidence of diabetes is increasing even in rural area, even in urban area, and the age of the patient in India of a diabetes patient, 50% of these 100 million patients are in the age group of 35 to 50. So it is a very productive age where patients have to look after their family. So loss of limb at this age can be a tremendous loss to the family, to the nation, to the society, and to the economy. So it is important to realize how can you prevent it, these ulcers, and how can uh, be healed. It is also a misnomer or it is also a misunderstanding that a small ulcer on the foot is an innocuous ulcer. It doesn't cause anything. But international statistics and as well as Indian statistics shows that a small innocuous looking ulcer, which is a neuropathic ulcer, has a higher mortality than breast cancer, prostate cancer, and Hodgkin's lymphoma. So it's not a very happy situation. So everybody, all the patients of diabetes must remember is that it's a small wound can be a source of a big trouble and a loss of limb. So with this introduction, I would now start answering the questions which Dr. Abhishek has about this.
Correct, sir. So my first question to you, sir, would be what are the tests that are usually done to check the nerve and the blood vessels of the foot, and how do we go about doing them?
See, if a patient is a diabetic, and at the day he is detected diabetic, he should meet the doctor. The doctor should test his nerve function and the blood vessel function. The tests for nerve function are of three types. There is a filament test which shows you whether you have a touch. It is a 10-gram filament which, if you touch it on the first, third, fifth metatarsal heads and the midfoot and the heel, the patient cannot feel 3 out of 5 pulses, then that is what we call as a foot at risk.
Correct.
This means the patient's sensation is reducing. Now, but there is a study called Diabetic Asia, which has shown that if in Southeast Asia, if the patient is detected diabetes, he's already diabetic for at least minimum 5 years. So majority of our patients, when they go to the doctor, they are already have a neuropathic problem because if it is undetected diabetes, the nerves of the legs are affected all over body, but the legs is what we are talking about. Then the vibration. See, vibration sensation is the second to go. And the vibration sensation can be tested by simple tuning fork on the lower leg and what is on the around the ankle. If patient cannot feel, again it is a sign of a something which is going to happen. Now this is vibration perception is a with a tuning fork is a subjective whether patient feels or not. There is an equipment called biostasiometer which quantifies this vibration into microns. And then if the patient cannot feel beyond 25, that means it is a neuropathy. Up to 25, it is normally person doesn't feel, but between 25 and 50, patient doesn't feel, then it is a foot at risk. So these are the two tests, and then there is also temperature test. See, normal human being, uh, is comfortable in a temperature between 24 to 29 or 30 degrees centigrade, but mostly 29. So if there is another equipment called uh, thermography. So in that you can see that patient has a you can check the patient's foot temperature and his sensitivity to the temperature right from 24 to 30 beyond 30. The importance of testing all this is that if you find that the patient's sensation is reduced, then you have to warn him that he is not going to feel pain, he's not going to feel heat and cold. So patient should not walk barefoot. All this care has to be taken. As per the blood vessels are concerned, like diabetes always affects the blood vessels. The blood vessels get thickened. The blood flow in the blood vessels does not reduce, but the speed of the blood flow reduces, what we call velocity. So
Correct.
what you have to do is to do a test called ankle brachial index. That means you measure the blood pressure at the ankle joint like you measure on the arm,
Mm.
and measure at the arm. So ankle pressure divided by brachial, that is the arm pressure, is the index which comes as a ankle brachial index. Normally this index is between zero point 0.9 to 1.1. If it is reducing below zero point 0.9 to zero point 0.9 to zero point 0.7 is a ischemia. That means the blood flow is reducing but not significantly. So that is the stage when you will have to do a further test called colored arterial Doppler, which is on a Beaker machine, shows you the topography of all the blood vessels from the pelvis to the leg. So you know which blood vessel is thickened, which is not working, and which is developing block. If the index is between zero point 0.7 and zero point 0.5, it is a severe ischemia with severe loss of lessening of blood. And below zero
Okay.
point 0.5 means it is impending gangrene. Also, it is a misnomer that if the index is higher, it doesn't mean that the blood flow is better or it is increasing. It only shows that the blood vessels are so thickened that they cannot be compressed. And the other test, which is a actually very specialized test to find out, see, if you have an index also normal and if the wound is not healing, that means between the artery and the wound there is some problem. So the measurement of that is that you do what is known as a toe brachial index. If there is a toe wound and if it is not healing, but you see the ankle brachial index is normal, that means between ankle and the toe there is some problem. So toe brachial index is also, there is a separate equipment which is normally zero point 0.7. Anything below zero point 0.7 is not healthy, it is not normal. The last very super sensitive test is known as the transcutaneous oxygen concentration. If the wounds, if many times you have a good ankle brachial index, good toe brachial index, but still wound doesn't heal. That means
Mm.
the oxygen at the circulation at the tissue level is less. So this is a transcutaneous oxygen concentration which is measured through the skin. Normally it should be above 30, 35, ideally 40. If it is not there, that means your blood supply is not adequate to heal the wound. So these are the basic tests which need to be done once a year. If you find that the index is coming down or patient is developing more neuropathy, then this has to be done more frequently, sometimes 6 months, sometimes 3 months, and also along with that you have to do the foot examination.
Correct, sir. So now moving on, I would like to ask you, sir, since the patients are so predisposed to having ulcers, what precautions should the patient take so that we can prevent these ulcers from happening?
See, normally, if the patient is detected diabetic and he is going to his doctor or a physician or any paramedic who does this test and they find that his sensation is reducing, that means
Mm.
his filament test is positive where out of uh, 5 places, 3 he cannot feel. That means he is prone to injury. Similarly,
Mm.
there is other test called touch test where patient even doesn't have to go to the hospital. His relative can test it by just lying patient on the bed flat on the back, and the relatives can touch his first, third, and the fifth toe. If he finds that out of these three, two he cannot feel, that is equivalent to the filament test. And at that stage, patient has to protect his leg. He should not walk barefoot because these nerves are not functioning. The sebum and sweat glands of the leg get destroyed or they work less. So patient doesn't have a sweat or the sebum doesn't come out. so the foot becomes dry. A dry skin usually will break, or dry skin causes, itching,
Hmm.
irritation. So patient scratches it and then he gets a wound. So that skin care has to be taken. Patient should wear proper socks. Patient should wear proper footwear. And we'll talk about footwear at the end of the show. But these are the precautions. And he should undergo regular tests. His blood sugar control should be all right. His HbA1c should be below 7. It should not increase. The fasting should be below 130, personal below 60, 160. So these are the precautions he has to take. If he wants to go to the temple, where the shoes are not allowed for any other function, there are specialized padded socks available, which are known as the temple socks, which he
Hmm.
can use to prevent the injury to the leg.
Now, apart from these precautions, sir, there are some specific foot care tips that the patients and the relatives can take together so that they don't develop this problem.
See, as I said, the skin becomes dry, becomes itchy, and it breaks. So
Hmm.
barefoot walking is no. But
Correct.
also simultaneously, because the nerves are not functioning, nerve supplies the muscles, so muscles become weak, so the shape of the foot starts changing. So
Hmm.
patient has to be very careful. He needs to check the footwear regularly and
Hmm.
get the foot examined from his doctor or a paramedic regularly. Now, along with that, there are something which happens, that it happens only probably in India. You see,
Hmm.
when a diabetic skin becomes dry and patient gets a corns and calluses, there is a peculiar smell which probably humans cannot, detect it, but many rats and ants detect it, and that causes many times rat bites to the toes, and
Hmm.
then patient's toe is injured. So it is safer to wear socks at night and sleep. Never walk barefoot, and also neuropathic patient whose nerves are not functioning. Because nerves are not functioning, there is a irritation. Patient gets variety of pains. It
Hmm.
can be pricking pain, it can be burning pain, it can be some other type of a peculiar pain which disturbs the patient's day-to-day routine. In that case, patient most of the time, as it goes in India, traditionally applies ice packs, hot fomentation, dip the leg into cold water or hot water, or apply a variety of indigenous medicines or variety of ointments available. So that should not be done because the skin can break. The
Hmm.
only simple solution is to prevent the dryness of the skin and always cover the leg at night. If the pain is unbearable, then there are medicines which your doctors can prescribe. But mostly, if the skin is kept intact, skin is kept smooth and in a proper condition, these pains don't get occur.
I would also like to ask you, sir, ki what special kind of footwear we can advise the patients once they develop the ulcer or we want to prevent the ulcers that can help them heal it or prevent it.
See, once the patient finds that his skin becomes hard or he starts getting calluses and corns, now this is a stage that means his neuropathy is advancing and the
Hmm.
shape of the foot is changing. The small muscles of the foot are becoming weak, so the bone becomes prominent. Simultaneously, the fat under the skin slowly dissolves, it thins out. So the bones become prominent, and every prominent bone is a pressure point.
Hmm.
So pressure point causes a hardening of the skin and causes a callus or the corn. So that stage patient should not reach that stage. So once you are detected diabetic, you must get a proper footwear. The footwear has to be properly modified to prevent the pressure areas, and it has to be made of a specific type and specific material. We will be talking about that at the end of the show. But patient must protect his feet, moisturize his feet after bath, before sleeping, washing, keep the skin clean. You must cut the nails properly, straight and square, and regularly after bath. Because if the nails get stuck in the socks, they can get torn and create an injury. And always wear diabetic footwear inside and outside.
Sir, there are some people who, even after following precautions or don't follow precautions, get wound on their foot. In case we get a wound, then what should the patient do in such a condition?
See, the wound, occurs because of few reasons. One is that patient does walk barefoot.
Hmm.
Second thing, if there are calluses which are neglected, they break down and form the wound. The dictum in diabetic foot medicine is that callus is a precursor of an ulcer, or it hides the ulcer. So
Hmm.
if there is a callus, underneath that there may be ulcer. So the regular procedure is that if the patient sees the callus, first of all, patient should not get callus because if he is protected with footwear he is using, it will not be there. But if it occurs, it needs to be scraped. Applying
Hmm.
some salicylic acid and other strong ointments can damage the skin. So you have
Hmm.
to clean that pond and remove the pressure point. If the pressure point is removed, then it will not break and form the ulcer. Also, in the footwear, you have to make adjustment to see that protects the pressure points and prevents the high pressure in the area and prevent the callus from formation. In case the wound occurs, unfortunately, the, the first thing patient should do is stop walking on the wound. Because he has a neuropathy, first he doesn't feel and doesn't detect the wound. The moment the wound occurs, he is not aware, so he keeps on walking. So the weight goes on accumulating in the skin and it will break easily. So it will
Correct.
further decay. So he should stop walking, do the dressing. We'll talk about that in the next part. And keep it clean and take rest. At least the initial small blister can heal within 8 days. So you have to take rest, don't put the foot down, and control your blood sugar so the ulcers heal. If they are detected late, then you will have to use a modified footwear. You may have to undergo some procedure to clean the wound. But the most important, if you are checking the foot every day evening before
Hmm.
sleeping, if you find any high pressure areas, blisters, corns, I think it needs a proper care from paramedic and offloading footwear.
Another point I would like to ask, sir, is what are some of the danger signs that the patient has to look out for in case he has a wound and he needs to see whether it is the spreading infection or the wound is getting worse? What should he look out for?
See, the first sign if the patient has less pain is that
Hmm.
patient's blood sugar may go up, the leg
Hmm.
will be swollen, he may get
Hmm.
fever with ligus. These are the signs of infection. And
Correct.
normally, most of the people are not aware that it is an infection in the foot. So
Hmm.
they check for, dengue, they check for malaria, they check for many other things. And then at a later stage, they realize it is foot. So I think
Hmm.
if a diabetic patient gets unexplained fever without any predisposing condition, first look at the feet, whether there is a web space fungal infection which is easily missed because the patient has no sensation. The foot remains wet in the web spaces which causes fungus. Remember, fungus infection has the three parts: the fungus, the host, and the environment. The fungus, many times in Indian weather, you cannot avoid. The host is immunocompromised, but the fungus you can control it by keeping the web spaces dry. So every
Hmm.
patient must, after bath, clean the web spaces with sanitizer so the vapor moisture goes because fungus does not grow without moisture.
Hmm.
So then if that occurs, what you need to do is that first offload and then treat it. If it is a small wound, it can be dressed at home with some simple antibiotic or any other ointment. And most of the time, this wound will heal. But at the same time, patient must make sure that he has a adequate circulation in the foot because if
Hmm.
circulation is poor, then the wound will not heal. Also, the
Correct.
thing to remember is that the callus which occurs because of a poor circulation is never hard because callus is physiologically hypertrophy. Hypertrophy will not occur without a good blood supply. But the
Hmm.
callus which occurs in ischemic patients or those who have blood vessel problem is very silvery thin. So looking at the callus only, you know that the patient has a vascular problem. So these calluses are never widely debrided. After that, you need to do a dressing with a simple ointment which will keep the wound environment, that is a ulcer environment, moist. It can be simple antiseptic gels usually, or there are variety of newer pads and ointments and all. Whatever is available, accessible and affordable, patient can use, but there should not be any pressure on the wound. So rest or non-weight bearing walk or modified sandal depending upon the size of the wound, size of the wound, and patient's economic condition, his age. All these things have to be considered while deciding the operating modality.
Correct, sir. Last question I would like to ask you, sir, is that once the patient presents to us with an active infection, the doctors take care of the wound. What advice then the patient should follow that he should to take care of the healing?
Patient comes with a wound, an infected wound, you do the surgery, you do everything excellently, and patient
Hmm.
goes home. I think most of the patient, as per the city of Bombay, are staying in a crowded environment. So you have to
Hmm.
talk to them about his, you know, social environment. A simple thing
Correct.
like not to walk weight bearing and usually to walk, go to the toilet with a walker. But in Mumbai city, almost 55 to 60% buildings have only Indian style toilets. So
Correct.
this is so you will have to talk to the patients. This needs lot of social counseling. This needs lot
Hmm.
of some social workers. You have to see what patient can do. Also, patients requires a proper dressing, not
Hmm.
dressing to be done at the patient's house, has to be done in a proper aseptic manner. If that is not
Correct.
possible, transporting the patient to the hospital every time is maybe possible, but it is costly affair. So you have to have a via media where you can teach patients' relatives, or if you have a dressing service which can be arranged at patient's home. But the most important are five things. Patient blood sugar should be well controlled. That means
Hmm.
his fasting should not cross 130, portions 160. The dressing has to be done in a very aseptic manner. Patient should not walk weight bearing. Now, if your patient is elderly, is obese, where he cannot use walker, then you will have to have some device or a footwear which can offload the ulcer bearing area of the foot. And that is also for limited activity. And also regular checking of the wound either by the dresser who goes home or patients coming to the hospital. If it is a large wound, then it needs to be closed as fast as possible, because large wound is again is a loss of all vital blood fluid and enzymes which will prevent the wound from healing, and instead of good metabolism it will go into catabolism. So you need to think all this, talk to patients, relatives, then only the wounds will heal. Once the wounds are healed, some wounds may require reconstruction, some other wounds require plastic surgeries or skin grafting, other methods. Once that heals, then you will have to give patient a very good proper footwear which will prevent the pressure on the ulcer bearing area or the healed wound, and counseling to walk, how to walk, you will teach him how to walk. The simple thing is again, many patients are staying in a building where there is no lift. So we have to teach them how to walk. See, the simple thing is when patient is taught to walk, he should walk with short steps, and he should put the first forward leg is one which is uninfected or doesn't have a wound, then the second leg. While climbing down or climbing up, also same procedure has to be followed.
Hmm.
And the wound fully heals, he should not walk normal with normal footwear. And then also, because he has undergone surgery, there will be always swelling, what we call edema of the leg. So patient
Hmm.
may require specialized stockings. Patient may require other type of devices to reduce the swelling, or maybe the medicine. So all this is a composite treatment where the patient's family has to be involved. It's not the doctor can do or a paramedic can do. They also have to do many things because patient require lot of
Correct.
social family support.
Correct. I would like to thank you, Balsar, for answering my questions. Any final word of advice you would like to give our viewers as a general part of foot care and footwear?
My advice for a footwear is that don't purchase the footwear from the market or any shoe shop, because diabetic foot diabetic patient's foot changes the shape, it changes the size. The size changes because in a human being size never changes after puberty. It is the shape which changes. So that authentic shoes are not ready-made available. So you have to the shoes or a sandal from a proper agency or a manufacturers who are used to doing all this, and they can only give you, but always with the doctor's advice. Don't go to the market and purchase the shoe. The few principle, never use any slippers. Every footwear which diabetic patient has to use after wound or with wound or even without wound, it has to have a heel support, what we call heel counter like a shoe. It should have a good insole of 7 to 8 millimeters of very specialized material which will distribute the pressure. It should have a straps which don't have a any metal studdings or buckles. It should be adjustable for edema. If it is a closed shoes, it should have a wide toe box. That means it should be very broad where the toes are not compressed. And it should not have a laces. It should have a velcro strap or it should be slip on. And sandals should not have any other thing except for straps which are padded so they don't hurt the skin. And these, remember, diabetic patient by evening gets a swelling because of a neuropathy which causes dilatation of the shunts between arterioles and veins, which causes edema. So preferably patient's measurement of the footwear should be taken in the evening so the edema or swelling can be accounted for, and patient should be encouraged to use this. The problem in India is that many patients go for religious function where they have to remove the shoes. In those cases, you will have to warn them to wear something else like a padded socks, which are known as a temple socks. But many people go for a pilgrimage barefoot. I think going barefoot for a long pilgrimage, we have seen in our hospital that many patients come back with ulcer. Many of them land up with amputation. So
Yes.
wearing the padded socks minimum is something which is very important, but never walk barefoot for the swelling, never apply any hot fomentation or pressure pads or massage devices. The swelling after surgery or even without surgery at the end of the day is a normal phenomena. It is a physiological phenomena because of the nerves and blood vessels not functioning. So the common perception in everybody's mind, the swelling means you apply something, hot fermentation, you apply ice packs, or you give some other devices. So these are all very harmful things which can cause loss of limb. Remember, foot can be easily saved if patient is involved in treatment and patient's family is also involved. Only doctor cannot save the food. It is a combination, it is a teamwork. And the most important part of the team is patient and his relatives. If they are involved in the treatment, then even complicated wounds will heal and patient can still be walking on his legs, but not without the cooperation of the family and patient, because they have to do many things like control of diabetes, looking after the patient, also keep the food clean. All these things have to be done. So this is my message: is that don't neglect the food, because if you lose the food, it is a loss not only to yourself, it is for your family. Because average statistic shows if the patient loses one leg, then the mortality at the end of 5 years is 75%. So at the young age, loss of life is a loss to the family, economy, and to the nation. So preserve your food, take routine care, spend 10 minutes every day night to see for four things. Is there any wound? Is there in between the toe any fungal infection? Is there any nails which are hurting the patient? And if there are any cracks in the heel or a sole of the foot, and if there are any wounds. I think the patient looks after that and wash the feet and apply moisturizer at night daily and use proper footwear. I think if that is done, all these 200,000 amputation can be drastically reduced, because they are due to neuropathic ulcer as compared to the Western countries where it is because of a vascular problem. Thank you.
Thank you, sir. I would like to thank you for joining us and guiding us with the proper good care that has to be taken. And I would like to thank the viewers for logging in and watching this info about the diabetic foot care. Thank you.
Thank you, Dr. Archie. Thank you.